I wanted to make this video because it's been about a month and a half since my last video. So shortly after I made my last video, I went to my doctor and I talked to her about like how I had been feeling like depressed for a couple of weeks, and I had been like doing some like self-harm behaviors, and she put me on 150 milligrams of Wellbutrin and kept me on 60 milligrams of Paxil. And then within I think it was 2 days after I started taking Wellbutrin, my depression really started to lift, and it was completely gone by a couple days later. And I had a follow-up appointment with her 2 weeks after that initial appointment. So I took the Wellbutrin for 2 weeks, but I noticed that I was experiencing one side effect, and that was related to my urinary system. So I talked to her about that side effect, and I told her how quickly the depression had lifted after I started taking it. And she said that the Wellbutrin would not have started working that quickly. So my depression must have just lifted because it was gonna lift anyway, even if I hadn't taken the Wellbutrin. So because the Wellbutrin didn't seem to have an effect on me, and I was experiencing that sort of unpleasant side effect, she took me off of the Wellbutrin. And since I was already on a very low dose of it, she said that I didn't have to wean myself off of it. I was able to stop cold turkey. And sure enough, that was fine for me. And my urinary side effects disappeared. It was 1 or 2 days after I stopped the Wellbutrin. So there were no lasting negative effects from the Wellbutrin or anything, but it just didn't work for me. And so now I'm on I'm still taking 60 milligrams of Paxil every day. And my anxiety levels are still very low. The Paxil is just, it's still working great for me. I don't have any side effects anymore. I think I haven't had side effects from Paxil, to be honest, for a very long time. So that's it in terms of medication. I'm just trying to think if I'm forgetting anything. I don't know if I've actually ever said this in a video before, but I also have a history of fainting, and it's been really I've seen lots of specialists and stuff, and it's been difficult to pinpoint a specific cause for why I faint. So last week I saw a respiratory therapist, and I had a pulmonary function test and some other respiratory tests done. And it turns out that I have hyperventilation syndrome, which is very, very common, especially in people who have anxiety disorders, but also in people who don't necessarily have anxiety disorder. Sometimes it happens and there's no clear cause of it. It just happens. But basically it's just it means that I take deep breaths too frequently, and it makes me dizzy. So I have an appointment coming up with my doctor, but the respiratory therapist, in his note to my family doctor, he told me that he was going to recommend that I take Ventolin, which is something that people with asthma take a lot. It's a bronchodilator, and it just it makes it easier for the air to get into my airways. But he did say that I don't have asthma, but my lung function was just a little bit, a tiny bit lower than what's expected of people my gender and size. So hopefully I'll be able to start on the Ventolin starting the next time that I see my doctor. And that will decrease my chance of fainting in public again. So yeah, I don't think I have anything else to say about medications. I think that's it. But yeah, so that's all for now. So I think I'm gonna go. But I do always look forward to your comments and your questions and your private messages and all that stuff. It does make me feel more connected to people, since, as you all know, I don't have friends in real life. So yeah, bye guys.